Hello, good afternoon. My name is Dr. Brad Bandicoot. You can call me Brandy. I'm famous for my smile, you see, and I'm gonna check your teeth today. How are you doing?
Hi, Dr. Bandy. My name is Baby Yoda. I'm alright. Honestly, I just came to get my teeth checked. Something isn't bothering me on the lower left side, and it's been concerning me, and I hope to get it fixed today.
I can definitely help you with that. But before we start, I just need to have a little bit more information regarding your health, if that's okay. Do you have any health problems? Are you taking any medications? Do you have any allergies? Any recent hospitalization or surgery for joint or any heart surgery, anything like that? Does anything from this sounds familiar to you?
Absolutely not, doctor. I'm healthy as can be, but something in my mouth is just bothering me.
Talk about that then. Could you tell me a little bit more in detail? Something like when does it bother you while eating or drinking, and is it pain or more of a sensitivity? Do you feel any bad taste in your mouth? How long does it stays? When does it start and how does it start? I know it's a lot of questions, but whatever information you can give me, it will be surely helpful to me.
Yeah, sure, doc. So honestly, the sensitivity starts when I eat or drink something cold or sweet. It's not very much though. I am able to tolerate it without pain medicine, but but sometimes it does get uncomfortable. Thank God there's no bad taste, and I don't think there's any other gum problems back there. Yeah, also, like, once it does start, it stays there for a little bit. I feel it's more sensitive than the other side of the mouth for sure.
That's pretty good information. Thank you, and I appreciate it. It really helps when the patient gives history in detail. Well, now I guess it's time where I have to take a look in your mouth, if that's okay with you.
Absolutely, doc. Do what you gotta do.
Okay, Mr. Yoda, I'm just gonna have a look, okay? Don't close your mouth in between, don't bite my fingers. Now open wide for me, please. Alright, that's enough, thank you. Huh, you got a big laceration, huh? It's gonna heal on its own, I guess. Well, let's see. Okay. Most of your teeth on the lower left looks good. There is just this one tooth where I see some food lodgement, and there is a lot of plaque buildup, meaning the bacteria sticking in there. I guess that's what it is. Feel with your tongue. Yeah, is it that one? Yeah, I see your eyes movement, and that's what it is. Okay. Okay. So let me check then. Okay. All right. So I feel that there is a cavity on the top surface of the tooth. It is definitely deeper, and it needs to be filled. We cannot leave it like that. Seems like it has been there for a long time, huh? However, it feels like the tooth can be saved, so we're definitely gonna save it. But before we jump onto that conclusion, I also want to do some tests, and I'm gonna take a few x-rays. I remember my receptionist telling me that you have old x-rays. Can you tell me how old are those?
Yeah, doctor. I don't really remember how old they are. Definitely a few years, so I'm not sure if they're gonna be helpful.
Yeah, a couple of years, it's not much of help. I have to take a new one, but I would still like to take a look at them. So let's see, okay? Hang tight. I will get the instruments ready for the tests. Right, Mr. Yoda. So the first test we're gonna do is called electrical pulp test. I know it sounds scary, but definitely trust me, you're not gonna feel the jolt of electricity, okay? The only thing you will feel is little warmth or maybe some kind of altered sensation. It will be definitely mild, so don't worry. The only thing I need your help with is holding this probe, okay, so that it completes the circuit. As soon as you feel anything in your tooth, just stop holding it. All right, did you understand that?
Yes, doc. I got you.
Okay, then let's do it. Okay, it's isolated, clean and dry. All right, I'm gonna do on 3 teeth, which also includes the tooth in question. Okay,
Got it, doc.
all right, let's get started. Please hold it for me a little bit closer, a little bit closer. Okay, let me take a toothpaste. Okay, Okay, let me know when you start feeling it.
Alright.
Okay. Was it too bad?
No, but that felt weird.
Okay, definitely it was your first time, so that's okay. Now the next tooth.
Okay.
Alright, very good. Now the other side. Yeah. Okay, you ready? Okay. Okay, good.
Okay.
I'm sorry about that. Alright, Mr. Yoda. So we're gonna do our next test, which is called the cold test. And as its name, you're gonna feel some cold sensation. As soon as you start feeling it, raise your hand, and as it fades away, start dropping your hand, and once it's gone, just completely put your hand down. Do you understand that?
Yes, Doc. I got it. Gotcha.
Alright, I'm gonna get started. I'm gonna check all 3 of your teeth, okay? Just like the other test. Okay, let's get started.
Got it, Doc.
Alright. Alright, 1, 2, 3, 4. Okay, good. Just like that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay. Now the other side. 1, 2, 3, 4. Okay, good. Sorry about that. I didn't mean to torture you.
It's okay, Doc.
Okay, so when I did the cold test, does any of your teeth still feeling any pain or sensitivity?
No, doctor. No pain or sensitivity.
Alright, so just 2 more tests and then we will do the x-rays. So both of these tests I'm gonna do together, okay? So in one test I'm just gonna feel your gums. If you feel any pain, just raise your left hand so that I know that you felt pain in that area. And in the other test I'm just gonna tap on your tooth. And if you feel any kind of pain or discomfort, just let me know. And again, I'm gonna test all of your teeth, all 3 of your teeth.
Okay, doctor. You got it.
Alright, let's do the tapping test first. Do you feel any pain?
Nope.
Now?
Nope.
Okay. Any
Nope.
pain? Okay.
Nope.
What about now?
Nope.
Okay. Now I'm gonna feel your gums. Raise your hand. Okay, you don't raise your hand. Okay.
Nope.
Any pain? Nothing?
Absolutely
Okay.
not,
The
Doc.
other side. How about that?
Absolutely not, Doc.
Alright. So you see, the only teeth I feel question about is this one. There is some food lodgement and it's a deep carious lesion. So we're gonna have to take care of that. Let's do the x-ray to see how deep is that cavity, whether it's going into your nerve, whether your nerve is affected. I don't think so, but I would still like to have an x-ray to see if there is anything going weird with your nerves or in the bone, okay?
Absolutely, Doc. Let's do it.
Hey, Mr. Yoda. Mr. Yoda, are you asleep?
No, I'm awake, Doc. What you mean?
Okay, I thought that took too long. Okay, so I took a look to your x-ray. I just want to show you a few things before I explain you further. So let's go, okay?
Oh my God, doctor. Are those my teeth?
Absolutely, yeah. See? Okay, so I want you to look at the bottom picture first. Do you see this dark shadow? That's actually the cavity where your food is sticking in. It is deep, but it is not very deep that it involves your nerve. And from the test, your nerves are alive, so that is a good news. Moving on, however, I see something very suspicious in your bone here. You see this white color round wall kind of a thing?
Is that normal, doctor?
Well, it's definitely not normal. There are some other conditions where it is normal, but definitely not this one, because you have a cavity and bottom we see this. You see the other teeth doesn't have that. So it's not normal, but definitely it is not something that you need to worry about. You see the top x-ray, I took it so that I can see the other teeth as well, and I don't see anything going on like that in any other teeth. So it's just that teeth, and it is because of the cavity. There are also other reasons you can have that, but here in your case, because it is because of the cavity that has been there for a longer time. It is called condensing osteitis. Okay, it is a low grade bone reaction, and it has caused because you have this cavity for a long time, and your body has your jawbone has been reacting to it, and that's why you have that. You understand that?
Yes, doc. Does that need to be treated, or will I lose my tooth?
My best recommendation at the moment would be just to observe that each time you come for your cleaning.
Okay, doctor. So what about the cavity? Do I need to get it filled, or do I need a crown?
Well, without any question, you definitely need to get it filled. If I say it in our language, you have something called reversible pulpitis. It definitely does not cause you a lot of pain. It can be on and off sensitivity or on and off pain, but if you do not treat it, it can cause an infection in your nerve, which can cause irreversible pulpitis, or it can do some bone infection, which could cause swelling on your face, and you do not want any of these conditions, correct?
Absolutely, doctor. Is there any way I can get this tooth filled now?
Yes, let me speak with my receptionist. We can definitely make arrangements to get you in today. The only thing is that we're gonna give you needle so that you don't feel pain, and the restoration will take around 30 to 40 minutes. And then, as I mentioned before, we're gonna keep that tooth under watch and also the restoration, and you should be all set.